Peripheral arterial disease is blockage of the arteries in all of the peripheral areas, meaning not in the heart. So the areas that we often deal with are the carotid arteries and the lower extremities. The lower extremities is the most common because it affects approximately 5 to 10% of patients that are older than 55. So it's a very common problem, and it goes along with the same types of problems that patients have that have heart disease: diabetes, elevated cholesterol, smoking, all those sorts of things. So when someone is diagnosed with peripheral arterial disease, one of the interesting things that we found is that they also have the same risk factors for heart disease. So the biggest thing is to control their lifestyle, such as smoking and diet and cholesterol level, for the whole picture of the patient, including their heart disease. Peripheral vascular disease of the lower extremities is a terrible problem because initially patients that are affected with it have difficulty walking. As the disease progresses, it can actually lead to severe low blood flow to the point where patients actually have to have an amputation of their leg. Now this is fairly uncommon. It only occurs in about 10% of patients with peripheral arterial disease, but in the United States that occurs in over 80,000 patients. So my goal is to still treat those patients because we seem to have reached a limit with the types of mechanical things that we can do, whether it's removing the plaque or whether it's doing a bypass. We still have these patients who have to have amputation. So we've taken a different approach, and that is how from a molecular level can we come up with new ways to help patients. And so that's why we're looking at different molecular biology techniques to improve the amount of blood flow, and with that is this clinical study that we're doing on stem cells, where we take stem cells that are obtained from the patient's own bone marrow and inject them into the leg to stimulate the growth of new blood vessels. We all have the stem cells in us and we all have the ability to grow new blood vessels. It's just that some patients have the inability to grow enough new blood vessels to avoid an amputation. One of the most exciting things about my job is that we're studying new ways to grow new blood vessels so that patients never have to have an amputation. It's one of the most exciting things that I do, and I think over the long term we hope to have some significant success in decreasing the risk of patients having to have an amputation.